Hi everybody, welcome back to the Dr. Sia channel. In the video here today, we're going to talk about even more in-depth, what is ISTDP. So I have one video already out there on what is ISTDP. Make sure you check that one out. But here's another one where I go a little bit deeper on what ISTDP is. Or I don't know if deeper, but I just talk more about it. And I know that a lot of people are interested in knowing more about ISTDP, so hopefully this will be useful to you. Let's get started. Alright, so ISTDP is a therapy that's developed by Habib Lou back in the 60s, and ISTDP actually stands for Intensive Short-Term Dynamic Psychotherapy. So that sounds like a handful. What does that mean? It basically means that it aims to very quickly get past your defense mechanisms and help you see your defense mechanisms and help you feel and experience the emotions that lie behind your defense mechanisms and help you understand your attachment patterns that bring out those defense mechanisms that hurt you, and to be able to better regulate your anxiety, so not use these maladaptive defense mechanism coping strategies, but instead be able to process your emotions, understand where your attachment patterns came from, how they came to be, how you came to be the way you are in your relationships, and help you identify alternative ways that you can be with your partner, with yourself, with the world, with your colleagues, and with your friends. So what's the key thing there? I just want to give you a flavor of what ISTDP therapy looks like. Now I have a bunch of videos here on this channel where I show you what ISTDP therapy looks like in these sort of mock therapy sessions, but they're actually not mock therapy, they're reenactments. I just want to point that out, that they're reenactments. So it means it's like what you see there actually happened with another person. Anyway, so basically it looks like this, right? You might sit down in ISTDP therapy with an ISTDP therapist, and they might say, what are the problems that you're having? And you might go, I'm not sure. And the therapist might say, you're not sure what problems you actually have? And you might go, no. And then the therapist will quickly start looking for patterns for you. They will start help you look for patterns. They might go, do you tend to not be sure? Do things but still not be sure about why you're doing them, like how you're coming to therapy here, you sit down and you're not even sure why you're here. And then you might go, no, I don't tend to, it's just happening here. Or you might tend to go, yeah, actually that's a thing that I do. I do tend to do that. I do tend to doubt myself. So therein, the therapist has already helped you find tendencies in your actions, tendencies in your patterns. And when you can find tendencies, they become predictable. And if they become predictable, then you can do something about them, right? So that's how the ISTDP therapist very quickly is trained to very quickly grab onto ideas, behaviors, thoughts, statements that you make that might be indicative of certain patterns that you might have. Once you're aware of those patterns, then you can use them for your benefit in your life, right? For you to be able to stop those patterns from happening so that you can take conscious control of your life, right? So here's another example. You might come to therapy, sit down, the therapist might say, what are the problems that you're having? And you might go, I don't know about you. And you might go, what happened? You might go, I don't really trust people who have beards, right? People who have beards are hurtful. People who have beards are harmful. Now, the therapist might go, okay, let's have a look at that. Let's understand that. Because it seems like some part of your mind is telling you that just because I have a beard, that I want to hurt you. Do you have that tendency outside of this room as well? Yes, I do. I'm always afraid of bearded people. Let's talk about that. Let's understand that. Because obviously, anti-beardism is not a very healthy ism, particularly in a world where anyone could have a beard and it could say just about or mean just about anything or nothing. So then you can overcome that. Now this person, once leaving therapy, once understanding that there's just some part of their brain that wants to make their world more predictable by making them avoid bearded people, but that actually doesn't really work, that because hurtful people could be people who have beards or don't have beards, they're better able to understand how they can regulate themselves, how they can manage themselves in a world where people have beards. So that sounds like a silly example, but believe me, there have been a lot of people who come to therapy and they've caught onto my beard or caught onto my eyebrows or my earrings or my bracelet or my hands or something, anything about me. And that's the way that they navigate their world. They walk around being afraid of people who have a particular eye or a particular beard or a particular bracelet or something like that. Of course, ISTDP helps you identify that that's not the case, that there's no relationship between a beard and a person who is going to be wanting to hurt you in somehow. And then you can feel more freed up to spend your mental resources actually finding more fruitful relationships for you. And God forbid then if someone comes along and actually, you end up liking them and they do have a beard, you can actually engage in a genuine relationship with them as opposed to being afraid of their beard. For example, let's give you another example of what ISTDP therapy does in this idea of trying to help you find your defenses, help you regulate your anxiety, and help you ultimately experience the emotions, thoughts, behaviors, fantasies, desires, and so on and so forth that you have behind of this. So you might come to therapy and you might sit down and your patient might go, what's going on for you? And you might go, I'm depressed. And then it might say, all right, so what sort of brings that about for you? And you might go, oh, I don't know, I just find that I'm flat all the time. I'm always flat and I'm always down. And the therapist might go, then when you're not, what happens then? I get anxious. So when I'm not flat, I get anxious. And then the therapist might say, all right, and what are the feelings underneath that anxiety? And you might recognize over time with therapy that, gosh, you tend to go flat because whenever you get angry, you get too scared of that emotion. So instead, you go flat. Instead of being angry at people who hurt you and asserting yourself with those people and setting boundaries, you get really anxious about doing that, about feeling angry and about the consequence of feeling angry, that you go flat and depressed instead. So now you understand that all of these reasons, 1,000 reasons that you thought that the depression was about, could actually be about a biopsychosocial spiritual tendencies that you have towards going flat because of all of these biopsychosocial spiritual reasons that you get anxious about your anger, and you instead get anxious and be really uncomfortable, and then you go flat instead. So by doing that, you can understand how your experiences, how what happens within you is sort of just happens on an automatic level, and you can start interfering with that process using your brain. You can go, oh, here it is, someone's making me angry and I'm about to go flat. I'm not going to do that. I'm just going to express myself instead. And then you find yourself using that anger to motivate you to express yourself to another person to say, hey, I don't like it when you do that. Can you please stop? Instead of needing to go flat. So I hope that this gives you a little bit of an understanding on what ISTDP is and what it tries to do and what the therapy could look like. In essence, you're going to sit down, and your ISTDP therapist is going to try to help you by finding patterns in your behavior, patterns in your thinking, patterns in your feeling, patterns in your desires, fantasies, and wishes, and so on and so forth, that tend to make you do things, think things, feel things that are not healthy for you, so that you can have a more predictable world, a more predictable self, a more predictable and controllable you that you can do something about. And once you can do that, then you'll live a more genuine life. So I'm not trying to plug it, that's just the case, that's just the way it is. When you can do more about you, you'll be able to engage more in the life that you want to live, as opposed to the life that your patterns, this unconscious stuff that goes on, forces you into. Let me know what you think about this video. I hope it was helpful. I hope if you're a patient out there and that you're thinking about maybe, trying ISTDP, give it a go. I find that a lot of people find it helpful, and a lot of people find it useful, and a lot of people find that even if they don't even really have a lot of problems, they go to therapy and they will find out all these patterns that might get in the way of their actualization, or might get in the way of their experiencing maximum joy in their life. It might just be that little thing that takes away your music, for example. A patient came to me and said, I don't really have a problem, but I just find that as soon as I sit down and I want to play a bit of music, that something gets away in that last bit of, as soon as I'm about to really compose something beautiful, that's when it stops me. The something comes and stops me. And we worked on that, and of course, it didn't take long before the patient said, that doesn't stop me anymore. I'm flourishing. I'm nourished. I'm flourishing essentially in my music, right? I have more flow now. So it doesn't have to be that you're sick or ill or diseased or disordered or whatever you want to call it. It could also be that you're just finding that some part of you just stops you from, actualizing or something like that. So anyway, look, I think it's a fantastic therapy. I know a lot of my patients have had massive benefits and experienced lots of good things in life from it. I hear reports like that all over the world. So if you're hesitated and you're wondering whether you should try it, give it a go. I mean, what's the harm, right? Yeah, right. Just give it a go. Alrighty. or sorry, subscribe and all that jazz. You know what I mean.